Welcome to this explainer. Today we're taking something that usually feels like, let's be honest, a massive, intimidating wall of text, dense medical device regulations, and we're going to translate it into an actionable, dynamic framework. We're going to explore how compliance isn't just some annoying regulatory hoop to jump through, but a strategic engine that drives real business value and, most importantly, keeps people safe. So, let's dive right in.
I want you to think about this for a second. What actually separates a life-saving medical device from a fatal flaw? Because when we're talking about manufacturing stuff like human pacemakers, artificial joints, or precision surgical tools, the stakes are quite literally life and death. A minor inconsistency in manufacturing isn't just a customer service headache, right? It's a potential tragedy. So the crucial point here is that the answer to that question isn't just having brilliant engineering or a super groundbreaking initial design. The true safeguard is an absolute, unwavering commitment to rigorous quality management. Every single day, across every single process. It's about making absolutely sure that the millionth device you produce is exactly as safe and effective as the very first one.
Here is our roadmap for the journey today. We're going to cover the stakes of medical devices, demystify ISO 13485, look at the core requirements and principles, outline the steps to get certified, explore the true value of that certification, and wrap up with how to choose your certification partner.
Section 1. The stakes of medical devices and why patient safety drives everything.
You know, medical device manufacturing is one of the most highly regulated sectors in the world, and for very good reason. The ultimate intent of these regulations isn't just to create a mountain of paperwork, it's to ensure that devices brought to the market are safe and fit for their intended purpose. From the initial design and development all the way through production, storage, distribution, and even disposal, patient safety absolutely must be at the center of the whole shebang.
Moving on to Section 2. Demystifying ISO 1385-2016. What exactly is it, and who needs it? It's actually kind of fascinating to look at the official definition. ISO 13485, specifically the 2016 version, is considered the absolute state-of-the-art quality management system standard for the medical device industry. Officially adopted on March 1, 2016, it's essentially the internationally written requirement for an organization to prove it can consistently meet both customer expectations and those really rigorous regulatory demands.
But who is this actually for? It's really crucial to understand that it's not just for the company whose name gets slapped on the final box. This standard applies to the entire supply chain. Whether you're the primary medical device manufacturer, a supplier providing a tiny specialized component, a service provider, or even a distributor or importer, you're part of the ecosystem. Basically, if you impact the product's quality, this standard matters to you.
All right, Section 3, Core Requirements and Principles. Let's build that framework for compliance.
Before we break down the specific ISO standard, there's a really interesting quote from an FDA manual on animal drug manufacturing inspections. It demands contemporaneous and complete batch production documentation. Now, you might be wondering, why bring up an animal drug requirement in a medical device explainer? Well, to prove a much broader point. Across the entire life sciences spectrum, meticulous, real-time record-keeping is the universal language of compliance. As far as regulators are concerned, if it isn't documented, it literally didn't happen.
So, building on that obsessive need for documentation, the ISO 1385 standard lays out some massive core requirements. First up, management responsibility. Top leadership can't just phone it in. They must be actively committed, setting quality policies and reviewing the system. Second, resource management. You have to provide competent, trained staff and the right infrastructure, like controlled environments and equipment. And finally, product realization. Every single step, from initial design verification to purchasing materials to the actual production process, has to be strictly controlled and validated.
But here's the kicker. A quality management system is definitely not a set-it-and-forget-it kind of tool. You have to actively engage in measurement, analysis, and improvement. That means reviewing data, monitoring processes, handling customer feedback, and catching any non-conforming products. The goal is to spot trends and drive corrective and preventive actions long before a mistake ever has the chance to reach a patient.
Okay, Section 4, Steps to get certified. Your roadmap to compliance.
So how do we actually transform these dense, heavy requirements into a living, breathing, certified system? Well, it's a sequential journey. First, you run a gap analysis to figure out where you're currently falling short. Second, you develop and implement your QMS, documenting every single process that impacts quality. Third, you do an internal audit to check your own work. Fourth, you face the music with an external audit from a certification body. And fifth, you commit to ongoing maintenance through continuous improvement and annual surveillance audits.
It's really important to notice the critical difference here between the internal and external audits. Your internal audit, that's a safe space. It's your chance to really stress test your system, find the broken pieces, and fix them internally. The external audit, though, is the main event. This is where an independent, accredited body officially assesses your operation to verify that your system is implemented, maintained, and completely compliant.
Section 5. The true value of certification. Let's look beyond just the regulatory hurdle.
Because achieving this certification isn't just about, passing a test to keep an auditor happy. It unlocks immense, tangible business value. The rewards are huge. You gain global market access because this certification is recognized all over the world. You inherently achieve improved product quality through rigorous process control. You build deep customer confidence because you're actually proving your commitment to safety. And you completely streamline your regulatory compliance, giving yourself a solid, structured way to navigate complex global laws.
Let's make this super practical for a second. Compare a chaotic, uncertified organization with a certified one. The uncertified operation usually suffers from inconsistent results, way higher rates of scrapped products, and excess waste, all because they lack structure. A certified organization, on the other hand, operates with consistent processes. They have a systematic way to investigate and resolve issues, and they routinely capture and share best practices across the whole company. It literally transforms chaos into daily efficiency.
And finally, Section 6. Choosing your certification partner. Why BSI is the ultimate guide for this.
Look, for a certification quest this critical, you absolutely need an experienced guide, an accredited certification body you can trust entirely. And that brings us to the year 1901. That is when BSI was established. Over a century ago. They bring an unbelievable legacy of trust and impartiality to their role as a world-leading national standards body. I mean, they're even incorporated by Royal Charter and are home to the ultimate mark of trust, the kite mark.
But what really sets them apart is their whole approach to excellence. They don't just send out some generic auditor with a clipboard and a checklist. BSI selectively recruits world-class degreed engineers. They put them through really rigorous, industry-leading training, and then they use this specific coding process to match you with an auditor who has deep, specific knowledge of your exact medical device technology. They actually understand the science, not just the paperwork.
On top of that, BSI's own credibility is backed by the absolute highest authorities. We're talking accreditations from around 20 top-tier international bodies across the globe. ANABE in the US, CNAS in China, RVA in the Netherlands, UCAS in the UK. This means when BSI certifies you, that certificate carries weight everywhere. Your hard-earned certification is universally respected, which drastically reduces your risk and boosts customer confidence.
Wow, okay, we've covered a lot of ground today. From the literal life and death stakes of medical devices to the rigorous demands and massive rewards of ISO 13485-2016. The path to certification is demanding. There's absolutely no denying that. But as we've seen, it fundamentally transforms compliance from this burdensome regulatory chore into a daily, systematic habit of excellence. It makes your business better, and for sure, it keeps patients safer. So looking at your own operations today, you really have to ask yourself, are you just waiting for a regulatory failure to force your hand, or are you ready to make excellence a habit?